Second cranial nerve is the optic nerve. In the assessment of the optic nerve, one should assess the visual acuity, the visual field, color vision, and lastly ophthalmoscope examination. Really, ophthalmoscope examination is mainly designated for postgraduate candidate, and the color vision need Ishihara test or Ishihara plates. And the first step in the assessment of the visual acuity, we have to the following points. First of all, if the patient is wearing glasses, we have to keep them, and we will ask the patient to provide us with the number that is seen upon the Snelling chart. This Snelling chart is 6 meters distance from the patients, and this is about the visual acuity. If the patient was unable to read any letters at that distance, we can assess his poor vision in the following manner. First of all, I'll check the calculation ability, and remember that each eye should be checked separately. حمادة هسه سوي من ايدك هيك وتصم منه عينك، هذا منه لا سوي لي بهاي ايدك وصم منه هاي عينك. هسه تباوع علي انا راح اسوي لك فد ارقام بايدي وتقول لي اياهن ايش قد. اوكي ايش قد اني
4 3 2 4.
Okay. If the patient was unable, this is just a demonstration, this is not a real exam. If the patient was unable, I'll assess just the finger perception, whether or not the patient was able to perceive fingers. هذا شنو؟ Okay, this is just to assess whether the patient was able to perceive finger or not. If the patient wasn't able to perceive these fingers, I'd really use light perception in the following manner. هسه هذا شنو؟ Okay, يعني ايش يجي على عينك هسه؟ Okay, the patient, as I said to you, he is a volunteer, not a patient at all, and he is able, but at the time of a clinical examination or clinical training, you have to check for that. And instead of a Snelling chart, we can also substitute or can give an order to the patient to read a number, for example, a far number, or we can provide him with number made from your finger from a far distance, and you can come up to the patient to assess him. After that, you have to check the other eye. This is what we call the visual acuity assessment, and then we have to check the visual field. In the visual field assessment, you have the following 4 steps. First of all, you have to check whether the patient had sensory inattention or not. That's to say, when a patient who had non-dominant parietal lobe lesion, he will have what we call the neglect or sensory inattention, and I'll check the sensory inattention in the following manner. This step, the only step in the examination or assessment of the visual peripheral or the visual field in general, that needs both eyes to be open in the following manner. هسه تباوع علي حمادة، فاتح عيونك تتباوع علي. هسه أنا خليت دي اثنيناتهم. هسه اريدك يا اصبع اللي راح احركك وتقول لي اياه. هذا هنا اوكي. هذا هنا اوكي. 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 Okay. Why I perform this test? Really, this is just to test whether the patient had a gross inability to perceive the waggling finger. Patient who had a non-dominant parietal lesion, he is or she is able to recognize the waggling finger when individually moved, but he will neglect one side when both of them are moved. This is really just to assess the gross visual field defect. After that, I'll check the central visual field. Central visual field, we usually use a red hat pen, and we have to know that the central visual field extends to 30 degrees from the central fixation in all direction. That's to say, if I see the patient laterally, I can assess that the central visual field up to this level and up to this level. Yes, just like this. This is the central visual field. I'll assess to quadrant above and 2 quadrants below, the same thing. This quadrant we call it nasal, upper and lower, and these quadrants are called temporal quadrants, also upper and lower. In the following manner, I'll ask him about, at each step you have to check whether the patient had color saturation or not, that's to say changing of the color instead of red into pink or pale. هسه حمادة, okay, I'll be about one arm from the patient. هسه صم النهمات هاي عينك. اوكي انا راح اصم هاي الكوالك. هسه اريدك تباوع عنا. هسه هذا لونه شنو؟ هذا احمر. اوكي هسه لا تباوع لي مباشرة على عيني وانا وياك خلينا نشوف. هسه هذا اللون شنو؟ احمر. هذا اللون شنو؟ احمر. هذا اللون شنو؟ هذا اللون شنو؟ اوكي. I asked him about the color because any color saturation indicate central visual field defect, also in the form of nasal and temporal quadrant. After that, since the patient had taken this position, I'll check for a blind spot. A blind spot really, for this eye for example, I'll move also the red hat pen about 15 to 20 degree temporal from the central fixation. This is the central fixation between him and me, about 15 to 20 degrees. He and me will be unable to see the color of the red hat pen for 5 degrees. Just for 5 degrees. I'll check for that in the following manner. هسه انا همات راح اخليها. هسه هذا شنو هو؟ لونه احمر. هسه تبقى تباوع لي من يختفي اللون عندك الاحمر تقول لي تتباوع لي. هسه اختفى شلون لونه تقريبا صار يميل للسواد. عافيه. هسه من يرجع النوبه تقول لي هسه اوكي. If the patient here wasn't able to, or he was able to recognize and I wasn't able to recognize, I can change the position of the red hat pen. This really, this area, exactly this to me. هسه تشوف لو ما تشوفه. اوكي هسه اوكي خلينا نرجع اليها from the central fixation. هسه تبقى تباوع لي من يختفي عندك او تقول لي هسه ما تشوفه. اوكي هسه رجعت تشوف. اوكي so this distance, about this distance, this is 15 to 20 degree. This distance between me and him, his vision had been superimposed upon my vision. شكرا. And we check the blind spot. Really, enlargement of the blind spot had many pathological conditions. After checking this eye, you have also to check the other eye. This is about the sensory attention, central visual field, and the blind spot assessment. After that, you have to check for the peripheral visual field assessment. Really, the peripheral visual field assessment, we have to have an idea about the field, how much is. The field extends about 130 degree vertically for monocular vision, and horizontally about 160 degree. Also, we will check it in 4 quadrants, 2 superior quadrant and 2 inferior quadrants, and we will classify the quadrant of each eye into, for example here I'll check the right eye into superior nasal, inferior temporal and superior temporal, and I'll check for waggling finger also when his peripheral visual field had been superimposed upon my peripheral visual field. Also in the following manner, I will be also at about 1 arm length from me. I'll ask him to close one of his eye. أصم إنهم نفس الحالة هاي عينك وأنا راح أصم هاي عيني وأنا راح أحرك أصبعي أوكي بيني وبينك. من تشوف الأصبع التناوب تقول لي أوكي. من تشوفه يتحرك دا تشوفه. هسه هماتين دا تشوفه أوكي. هسه من تشوفه الأصبع هماتين تقول لي اوكي دا تشوفه. اوكي هسه هنا من تشوف الأصبع بينه وبينك هسه أنا من تشوف الأصبع دا يتحرك هماتين تقول لي أوكي دا تشوفه. هسه هنا من تشوف الأصبع هماتين من يتحرك هماتين تقول لي أوكي دا تشوفه. أوكي both for quadrants are assessed. هسه صملنا هاي عينك هاي إيدك أنا هماتين راح أصم هنا بنفس الحالة هماتين راح تشيك بينه وبينك من يتحرك تقول لي أوكي 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 دا تشوفه. So I check for example for this eye superior temporal, inferior temporal, inferior nasal and superior nasal, upon which I stated, upon which you can check whether the patient had hemianopia, that's to say he had half of his visual field being lost, or quadrant anopia, that's to say just quadrant from his visual field is lost. And after that you can interpret the finding into many or a variety of clinical condition and pathological condition. The third, this is just about the visual field. The third step, as I said, is the assessment of the color vision, and we have to have an Ishihara plates. And the fourth step, the ophthalmoscopic examination, which is mainly designated for postgraduate students.